Well, hello and welcome to a Sunday coffee with Dr. Childress, without the coffee because it's Monday, and without the Sunday because it's Monday. Um, my plan on YouTube is to provide content on a regular basis, and so every Sunday I'm planning to, excuse me, produce a Sunday coffee with Dr. Childress. In addition, though, I'll be providing additional talks and seminars on a variety of topics going forward. And so you'll see different videos on different topic areas coming forward. Today, I'm going to take one of those additional slots to talk about parental alienation syndrome and the self-proclaimed PAS experts in the family courts. You'll hear me talking about the forensic psychologists on one side, and then we have the PAS experts on the other. Both of those groups have been in the family courts since the 1980s. Both of those groups have been entirely unsuccessful in their various endeavors of forensic psychologists with their custody evaluations and the PAS experts with their supposedly new form of pathology. And so we'll want to talk about the PAS experts and my concerns surrounding them. So let's do that. Let's talk about what's going on there. So this is from two of their top experts who provide sort of the conceptual leadership for parental alienation syndrome, Doctors Burnett and Larandos. And they've come up with this 5-part model for the diagnosis of parental alienation. So just with the title there, there's no 5 factors. They didn't do a factor analysis on any data. They're using the word factor in its literary sense rather than its research sense. And so it's a 5-part model that they've just imagined into existence because there's no research data surrounding it. And then the diagnosis of parental alienation, there is no diagnosis of parental alienation. That's a factitious diagnosis disorder imposed on the general public. And so there's problems just right away from the title regarding the spread of medical, psychiatric, psychological misinformation. There is no diagnosis of parental alienation in the DSM-5. But to look at what they say, just starting off right, like their opening sentence. Although the phenomena that we know as parental alienation, PA, has been described in the mental health and legal literature for many years, it was eventually given a name, parental alienation syndrome, PAS, by Richard Gardner in 1985. So notice that all the talk about parental alienation was before, and eventually Gardner came along and gave it a label 40 years ago that he just made up. There's no such pathology as parental alienation. And so it was given a name by Richard Gardner in 85. As time went on, notice their article too, 2020. Okay, so this is like 40 years later. As time went on, most writers abandoned the use of the word syndrome and simply referred to this mental condition as parental alienation. Okay, there is no mental condition of parental alienation. That's not in the DSM-5. That's not a diagnosis. They're just making this stuff up. So referred to as parental alienation. For the purposes of this article, PAS and PA are synonymous. And so that's a critical point. That when you say parental alienation, you're basically talking Gardner's PAS, and you're basically talking from these folks, Burnett and Larandos, who continue on with Gardner's belief that they have discovered a unique pathology that exists only in the family courts because we need a unique set of symptoms for just this pathology. But they've never explained why this exists only in the family courts. Is there parental alienation out in the general public? Where? How? How do we see? No, it only exists in the family court. I will propose that there is no unique pathology in the family courts, that anything that exists in the family courts exists in the general population. I will suggest that it's a product of narcissistic borderline dark personality pathology that's everywhere in our society that's getting triggered by the family divorce and the custody battle. So that's why we see it in the family courts. I would suggest it's not a new pathology that Bill Burnett and Lorandos and Gardner just discovered, that it is unique and requires its own unique label and its own unique diagnostic symptoms made up by them. Okay, so they're the only ones making up these diagnostic symptoms, 8 symptoms of parental alienation, this pathology. No, that's not true. Okay, that's just simply a made up pathology. There's parallel process, and anybody who knows me has been following along as my discussions of parallel process. This pathology is a pathology of lies. It's a factitious disorder, and parental alienation syndrome is a factitious diagnosis imposed on the public. It's a factitious, it's just the entire thing about this pathology is a pathology of lies. And this is one of them. It's a factitious diagnosis. So here is the actual DSM-5 diagnosis when we apply actual diagnostic systems. For the allied parent, what they're talking about, child rejecting a parent, the pathology is a persecutory delusion. So DSM-5 297.1, delusional disorder, shared persecutory type. It is a false factitious attachment pathology imposed on the child for secondary gain to the allied narcissistic borderline dark personality parent of manipulating the court, spousal abuse, and use the child as a regulatory object. DSM-5 300.19 FDIA. It is either or both of those wind up on the child psychological abuse diagnosis, V995.51, and it is spousal abuse of the targeted parent using the child as a weapon, V995.82. So those are the actual diagnoses using an actual diagnostic system. Okay. So this whole thing about parental alienation syndrome is medical-psychiatric-psychological misinformation being spread to the general public. There is no diagnosis of parental alienation. So let me just run back a little bit to that earlier statement of theirs. If you look at the title, it says, for the diagnosis of parental alienation. Okay, that's medical misinformation. There's your diagnosis of of the pathology. So they are covering up and hiding the actual DSM diagnosis behind their proposal that they're discovering some sort of new pathology. Now, if they present both of those together, then they're not applying misinformation. They're making up a new pathology and stuff, but at least they're not withholding the actual DSM diagnosis. But I will assert that they are not presenting the DSM-5 actual diagnosis and are simply presenting to the general public their made-up pathology proposal. Now, I'm going to suggest that's a tremendous conflict of interest to withhold actual DSM-5 diagnoses so that you only promote your new pathology proposal to people. And there's different consequences of the two. Because when you present only PAS, the solution for parental alienation, there's no diagnosis for that. So you don't go into the healthcare system to prove that or to get a diagnosis, because there is no diagnosis. You go into the legal system to prove parental alienation to a judge at trial, where guess what? You're going to need these experts, these self-appointed experts, to come testify on your behalf to a judge trying to prove their proposal to the judge. So you wind up trying to prove their assertion of a made-up pathology to a judge, rather than the alternative, which is the other path. If they tell you the DSM-5 diagnosis, you go into healthcare system to the doctors and get a diagnosis, which is the child psychological abuse, ultimately the spousal abuse, the delusional disorder, the factitious disorder. You get those diagnosed. If you stay in established knowledge, if you go to parental alienation, you don't. So I'm going to suggest that's really harmful to parents, the spread of medical psychiatric misinformation for their own personal gain, because they're the experts who will then benefit if people believe in parental alienation, who will benefit from being called in as experts in these court cases. Plus, they're getting outlawed by Caden's law. So it's just a problem what they're doing, okay, on this situation. So I do suggest that this proposal of parental alienation / PAS is unethical from doctors. I will suggest that it's a violation of Standard 2.04, Bases for Scientific and Professional Judgments, that requires all psychologists to rely on the established scientific and professional knowledge of the discipline as a basis for their professional judgments. And I will say that the DSM-5 and ICD-11, attachment and family systems, but certainly the diagnostic systems of the DSM-5 and the ICD-11 are the established knowledge of professional psychology. So those should be applied all the time in diagnostic formulations. So if they want to come up with this imagining that they are somehow special and special knowledge and skills that allow them to discover new forms of pathology that no one else recognizes, if they're going to make that assertion, they should do so only after they've applied the DSM-5 and ICD-11. Okay, not before, not instead of, after they apply the established knowledge pursuant to 2.04. So apply the DSM-5. The problem is, though, for them, if they apply the DSM-5 diagnostic criteria, it's going to be a shared delusion, factitious disorder, child psychological abuse, spousal abuse. And so then we don't need parental alienation. They admit that it's just a made-up pathology over here because it's actually in the DSM-5. Or they have to say, no, it's not a delusional disorder, it's parental alienation. No, it's not a factitious attachment pathology imposed on the child. It's this new pathology, parental alienation. No, it's not child psychological abuse. No, it's not child psychological abuse. It's this new thing called parental alienation. And no, it's not spousal abuse using a child as a weapon. It's this new thing called parental alienation. So what they are essentially doing is they are hiding the child abuse and spousal abuse and delusional factitious. They are hiding the actual diagnoses behind their parental alienation. So if they, one way or the other, if they identify it using the DSM-5, then they admit there's no such thing as parental alienation because it's in the DSM-5. Factitious disorder imposed on another, boop, done. Child psychological abuse, boop, done. But if they don't say that, then they're arguing it's not child abuse, and it's not because they've found a new pathology. It's not a factitious attachment because they've discovered it. No, they're just making stuff up. Okay, so they are withholding, hiding the actual DSM diagnosis from the general public, from the court's understanding behind their made-up pathology. And they've done it for 40 years, and you can just look back at the history, and you'll see that there's been no discussion of the actual DSM criteria and pathologies because everybody's fighting about parental alienation. So I would argue that it's a violation of 2.04. I would argue that it's that the established knowledge is DSM-5 and ICD-11, in addition to attachment, family systems, other areas. It's a violation of 2.01. I will suggest that they are not competent in attachment or family systems and in the DSM-5. If you don't know how to apply that as a basis for your judgments, that's worrisome. And standard 3.04, that's a typo there. That should be 3.04, avoiding harm. And the avoiding harm, we'll talk about that in a second. We have an obligation, if we're going to do something, to take reasonable steps to avoid harming people and to minimize that harm where it's unavoidable and foreseeable. When you leave the DSM-5 and ICD diagnostic systems and you start proposing new pathologies of your own, I will suggest that could potentially harm people because you're diverting them away from healthcare and diagnoses over into a new pathology that's not proven and various things. So the question becomes, what reasonable steps do they take to prevent harm? I would say provide the DSM diagnosis along with your proposal, but they're not doing that. So I'm not seeing they took any steps to prevent the harm to parents that's occurred over the last 40 years from trying to prove the made up pathology to a judge. So I will suggest that it's not only unethical, it's reckless behavior by doctors. It is reckless for doctors to leave the DSM-5 and ICD-11 for their diagnostic formulations. Okay, that's my assertion as a doctor. That's the established knowledge. That's your diagnostic systems. When you start making up new pathology that's not in those systems, that's reckless. And not, it's not just making up the new, it's not applying the DSM-5. So they're refusing. That's critical. They are refusing to apply the DSM-5 and ICD-11. It's not that they're just not applying. They're refusing. No, I'm not going to do it because I'm only going to apply my new pathology proposal to this thing and continue to assert that I'm somehow special in discovering a new pathology because of my special knowledge. Okay, which is no, they're not. They don't possess special knowledge and they're not discovering something new. So there's your APA Ethics Code 3.04. Psychologists take reasonable steps to avoid harming their clients, patients, students, supervisees, research participants, organizational clients, and others with whom they work. So just on that clause, that's pretty much everybody. So the APA is saying everybody you work with, if you have to take reasonable steps to avoid harming them. Okay, that'd certainly be the child, and that'd certainly be the parents, and that'd certainly be the court's decision making. So what reasonable steps have the PAS self-proclaimed experts taken relative to their proclamation that they are discovering a new form of pathology? And then the second part of that is to also minimize harm where it's foreseeable and unavoidable. I will suggest that if you're going to leave the diagnostic system of the APA, of the DSM and the ICD-11, if you're going to start making up new pathologies, there's some foreseeable dangers on that. Okay, one is misdiagnosis, huge danger is you're going to misdiagnose a pathology if you don't diagnose it. That's kind of linear logical reasoning on that one. If you don't diagnose the pathology, there's going to be a danger that you're going to misdiagnose the pathology. So, what reasonable steps have these PAS self-proclaimed experts taken to eliminate that harm, to avoid harming patients because of misdiagnosis, and to minimize that harm when it's foreseeable? Okay, I will suggest they have taken no steps, and in fact, that they are harming the general public because of the spread of medical, psychiatric, psychological misinformation. Here's the harm. Here's what I will propose is the harm being done to the general population and the courts relative to this PAS proposal. PAS represents the spread of medical, psychiatric, psychological misinformation to the general public. And by withholding actual DSM-5 diagnostic information from the general public, this will harm the parents and children by diverting them away from healthcare and a diagnosis, actual diagnosis, into the legal system to prove a made-up pathology to the judge. And so I'm going to say all of that is going to be harmful to parents and children financially, emotionally, the family. It's not going to solve anything, and it's going to be really bad. So that's going to be a harm. In addition, by withholding actual DSM-5 diagnostic information, such as the diagnosis of child psychological abuse and factitious disorder imposed on another, from the general public, this will harm the courts, who will then not have the relevant information needed for their decision-making surrounding the child. So I will propose, suggest, assert that PAS and these PAS self-proclaimed experts are harming the children and harming the parents in the family courts with their new pathology proposal and their withholding of the actual DSM-5 diagnoses from the general public. and from their understanding and from application. And excuse me, and they are harming the court's decision making surrounding the child because the court doesn't know it's child psychological abuse. A court doesn't know it's a shared delusional disorder or a factitious disorder imposed on the child. Because you're fighting about this new pathology, parental alienation, which hides or obstructs, obfuscates the clarity of the diagnosis. So again, there's your DSM-5 diagnosis. Okay, so we need to start applying the DSM-5 as a basis for our professional judgments, and there's your DSM-5 diagnosis for the pathology. Now, if somebody's going to argue that and say, no, in this case, it's not a delusional disorder, it's not a factitious disorder, a factitious attachment pathology in the child, and so therefore it's not child abuse or spousal abuse, well, that's fine. Okay, make that argument. Cite up the symptoms and say, no, this doesn't apply, and apply the diagnostic criteria. That's fine. Okay. But at least we're talking about real things rather than fake things. Okay. And we have diagnostic criteria for all of those. Okay. Delusional disorder, I can do a mental status exam. I can pop it out in a session, a delusion. And the factitious disorder, that's a rule out diagnosis, and that's done. If the targeted parent is a normal range parent, if they're not abusing the child, and the child's rejecting that parent, then that's a false, factitious attachment pathology because the child's seeking to flee a normal range parent. So, there's ways of making those diagnoses based on the symptoms. Or the targeted parent could be abusive, and then we'll have a history of physical abuse, or we'll see it, sexual abuse, whatever the abuse is, it's causing the child to flee. One way or the other, it's going to be abuse, because that's the only thing that causes a child's symptom to flee a parent. So, so there's your diagnoses on this situation. So let me talk now a second about these self-proclaimed experts. And the important thing to understand is they are self-proclaimed. Okay. As far as I look at them, I'm not seeing actual expertise in anything other than their self-proclamation that they are discovering a new pathology that's unique to the family courts and that no one else sees, and is just really awful symptom diagnostic stuff, and is just really a problem. Okay. And so you got they kind of group, you got this little group, and primarily it was Richard Gardner who dropped in the whole thing. But it's been driven a lot by this one psychiatrist, Dr. Bill Burnett. And Dr. Lorandos has also been with him, and a few associated people. But it's really a psychiatrist. And so when I looked at Bill Burnett's Vita, when I look at all their Vitas, I'm not just seeing the absence of expertise in anything. I would actually, on a 1 to 100 scale, I'd put most of them 30s, being generous a little bit. Okay, so I'm not seeing 70 or 80 on a 100-point scale. I'm seeing 30. I'm not even seeing 50. Give you an example. Dr. Burnett. Okay, I don't want to get any more trouble with him, but he's out there proposing, he's thinking up a new pathology here and is finding something. He kind of opens himself up for questioning, where do you think you're an expert on this? And so I've looked at his Vita, and I'll do it up on the internet at some point if I have to. But he's a professor out of Vanderbilt medical school. He's a psychiatrist. Okay, first off, a psychiatrist, that's medical school. Okay, so he has no psychology school background. He's not a psychologist. He's an MD doctor trained psychiatrist. So he has no background in attachment or psychotherapy models or just a variety of things, family systems therapy, none of the psychology side of things. Mostly psychiatrists deal with medication, like for bipolar or ADHD or schizophrenia, they're kind of med support. They kind of do some psychoanalysis because of Freud and people that kind of grandfathered themselves into analysis, but they're not family systems therapists. They're not attachment people. That's early childhood. Those are your psychologists. So I got a psychiatrist right off the bat instead of a psychologist. And he got his medical degree in 1968. Okay, what is that? 78, 88, 98, 2008, 2018? That's like 55 years ago. He got a medical degree. Okay. And you look at his vita, he hasn't had any additional training in attachment or anything since that point. He's entirely been focused on this PA, parental alienation. That's his entirety of his focus. You look at his articles he's written, you look at everything he's done. Okay, so he hasn't been getting trained up in family systems or getting trained up in attachment pathology and stuff. And you'd think, as a psychiatrist, he would be able to diagnose a delusional disorder. You'd think. Factitious, those are, APA psychiatrist book, the DSM-5. And you'd think he'd be able to apply the DSM-5. But he's not. For his entire career, he did not apply the DSM-4. Then he did not apply the DSM-5. And I will suggest, as a result, he misdiagnosed the pathology. He misdiagnosed it as this new pathology he's discovering because he never bothered to go back and look at the DSM-5 and apply actual knowledge. It was in the DSM-5. It was a shared psychotic disorder. That was a shared delusional disorder. It was there the entire time. It says he just gave himself permission to not use the DSM-5. I think that's reckless. I think that caused a lot of harm to everybody by getting everybody to fight over his new pathology proposal rather than directing everybody appropriately into the DSM-5 for the delusional disorder and factitious disorder diagnosis, and went the DSM-5 into the child psychological abuse diagnosis, spousal abuse diagnosis. So he's diverting everyone away from the application of established knowledge because he's asserting he's got special knowledge that no one else has. He and his little group to find and discover a new pathology unique to the family courts for which we need unique new symptoms. So he's amazing. And then we got Lorandos, who's a psychologist. And I will say Lorandos is not competent in the diagnostic assessment of delusional thought disorders. Look at his vita. Where did he get his competence in delusional thought disorders? Where did he get his competence in attachment pathology? We're working with attachment pathology. We're working with possible delusional thought disorder. We're working with a possible factitious disorder imposed on another. Where is on Dr. Lorandos, where on his vita, does it show his education, training, and experience with child abuse and complex trauma, with attachment pathology, with family systems constructs and principles, with the assessment of delusional thought disorders, with the assessment of factitious disorders? So I'm not seeing it, okay, where they are somehow elevated experts in something. There's no research on their pathology in the family courts. The only research is this, soft stuff of Amy Baker primarily, and more recently Jennifer Harman. So let me talk about those two. Those two are researchers. Okay, they're college professors. They're not licensed clinicians. They've never been trained to assess, diagnose, or treat anything. They are not clinicians. So any opinion that they have about the diagnosis and treatment of pathology is beyond the boundaries of their competence because they've never been trained in how to diagnose or treat pathology. So they can do their research and say, oh, we're discovering a new pathology. Okay, so offer it up, because some people remembered that maybe they were alienated based on your soft definition. That's not really research much. You're not in the family courts actually collecting data about anything, so you're not applying actual knowledge of the DSM-5 to your research. So your research is not grounded in the established scientific and professional knowledge of the DSM-5 or attachment or family systems. So I'd argue that even the research studies of Amy Baker are in violation of 2.04, and Jennifer Harman are in violation of 2.04. So both of those, Amy Baker and Jennifer Harman, run super duper close to a violation of 2.01 boundaries of competence if they're opining about the diagnosis and treatment of pathology. They're not trained as clinical psychologists. They're not licensed. And I would suggest that both of them, their research itself, is in violation of 2.04. It should be including a DSM-5 diagnostic workup as well as their new pathology at the very least. I'd say just get rid of the new pathology and rely on the DSM-5. You know, why do we need parental alienation? It's a factitious disorder. It's delusion. We don't. We do not need parental alienation. Use of established knowledge. So, and then, over in England, there's Karen Woodall, a master's degree, and same kind of thing. I'm looking at her Vita. I just don't see the background in where delusional thought disorders. That's where they're all weak. Linda Gottlieb, very old social worker, master's in social work. Look at her Vita. I'm not seeing it. So I'm not seeing expertise in anything. I'm not even seeing competence in anything. And yet these are the self-proclaimed experts in a new form of pathology they assert they're discovering. I'm going to say that's the spread of medical, psychiatric, psychological misinformation to the general population, to the harm of the general population. And one of the primary harms is it hides the child abuse from view. Okay, so the use of made-up pathology labels such as parental alienation, resist-refuse dynamic, parent-child contact problems, the last two are from the forensic people, those serve to hide the child abuse from view. They hide the child abuse from the court's understanding, and they prevent effective intervention for the child abuse. So if I come out of trauma and foster care, if you know trauma and foster care and child abuse, you do not use euphemisms for child abuse. It's not inappropriate affection syndrome. It's child sexual abuse. It's not overly harsh, parenting dynamic. It's child physical abuse. And it's not parental alienation or resist refuse dynamic. It's child psychological abuse. And when you use euphemisms for the child abuse because you have not applied the DSM-5, and so you give yourself permission to make up new pathologies of new euphemisms, you will hide the child abuse from view, from the court's understanding, and from effective intervention. So stop doing that. Apply the DSM-5, shared delusion, factitious disorder imposed on another, child psychological abuse. Identify the child psychological abuse for the parents, for the child, for the family, for the court, and we can get effective intervention to stop the child abuse. Okay, that's the harm when you go away from established knowledge, when you start making up new stuff. Okay, don't do that. Stay grounded in the DSM-5, please, as your ethics code and as professional standards of practice require. Final piece on this is that all mental health professionals have duty to protect obligations, including me. And so here's from Wikipedia. In medical law and medical ethics, the duty to protect is the responsibility of a mental health professional to protect patients and others from foreseeable harm. From where I sit as a doctor, applying the DSM-5 to my diagnostic formulations and professional judgments, I believe the actions of a number of mental health professionals are extraordinarily reckless and are outside the bounds of established professional practice, and are failed in their duty to protect obligations relative to the child in the family courts and the parents in the family court. I will further assert that, based on my understanding, that I'm concerned about the harm they are causing to the general public through the spread of medical, psychological misinformation by withholding the DSM-5 diagnosis relative to their made-up pathology proposal. And so I have duty to protect obligations to correct the medical, psychiatric, psychological information being spread to the general public to the harm of the children and parents and courts. So that's what I'm doing. I'm informing the parents, children, parents and courts about the actual diagnosis, a DSM-5 diagnosis. shared delusion, factitious disorder, child psychological abuse, and spousal psychological abuse of the targeted parent using the child as a weapon. There's no such thing as parental alienation. That's a made-up pathology. And so in doing that, I am seeking to correct the harm, to take reasonable steps to avoid harming the parents and children and courts, and to take steps to minimize that harm where it's unavoidable because of the actions of other mental health people, the irresponsible actions of other mental health people in leaving the diagnostic systems of the DSM-5 and ICD-11 and proposing a new form of pathology that they are discovering while withholding relevant diagnostic information from the general public. So with that, this talk is over. Okay, so that's my concerns relative to the PAS and these self-proclaimed experts in this made-up pathology. I believe it's harmful to the courts, harmful to the children, harmful to the parents. I believe it's reckless. I believe it's irresponsible. And to withhold actual DSM-5 diagnostic information from the general public's understanding. And I believe it's unethical. Violation of 2.04, right off the top. Violation of 2.04. Then we'll have a violation 2.01. We'll have a violation of 2.04. And if they offer opinions in court or into something, 9.01 bases for assessment, if they ever are involved clinically with the case. So with that, good luck, everybody. Patients should never have to explain the pathology to the doctor. The doctor should already know. And so with that, good luck and take care.